Hey guys, week 7, chapter 26. Okay, so this is a pretty quick chapter. A lot of it's just about the anatomy, physiology, and the functions, pathophysiology of everything. So I'm just going to breeze through it. I'm going to tell you the important parts I want you to know, and it's just about you putting this to memory. I was talking to Yvonne. I don't think you guys have covered this in anatomy yet. So, but when you do, like before, you'll be experts. Okay, so I'm just going to jump right into it. I'm going to just point out important facts, things I want you to know, and then we'll be good. I also have 2 handouts I was going to look at today. This little guy right here, the absorption of majority nutrients, and then the bile one. Look for the biliary excretion of waste products. Okay, cool. Okay, let's do it. Chapter 26, page 300, week 7. The digestive system. Okay, so blah, 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 all kinds of cool words and things to know. In a lifetime, the human digestive system will process about 50 tons of food. Wow. My dad said he's already processed that much. Ha ha. So the entire mechanical and chemical process is often called digestion. So digestion is referred to all of that what's going on in the GI tract pretty much. So here, the elements are used for energy and building cells, anabolism, which is the building of cells, and wastes are eliminated. So they go in and they come out. But in the process, things are absorbed and used. So you have what's called the alimentary canal, which is the GI tract or GI system. The whole canal or tube is about 28 to 30 feet long. Food travels to the GI tract in about 24 to 36 hours. The GI tract is controlled by the nervous and endocrine system. Pretty cool. They consist of carbon, hydrogen, and oxygen. Proteins also contain nitrogen. So because the GI tract is open to the outside and because non-sterile material such as food is introduced into it, it is not considered sterile. However, when they do surgery, it should always be sterile because you don't want to introduce anything other than what's in there already. Okay, so then it talks about the mouth. Put it in your mouth, you eat it, you swallow. It talks about the palate, which is the roof and everything of the canal of their mouth, and you're going to learn all about that later. Then it talks about your salivary glands, which is super important because about 1 to 1.5 liters of saliva into the mouth is produced daily. Now under the tongue, there's 2 little things that that are part of the salivary glands that excrete saliva. So look in the mirror, look at them. It's kind of cool. After I learned that in A&P, I was like, whoa. Anyways, though, 2 types of saliva exist. The watery, which kind of helps keep your mouth moist, and the other one is what's called mucin, which lubricates food and causes food particles to stick together to form a bolus, a ball or lump. It also contains ptyalin or salivary amylase. So basically, it's going to produce enzymes. So also, saliva helps prevent oral infections because it contains lysozymes, bactericidal enzymes, and immunoglobulins, IgA. The pH of saliva is normally about 6.8, so it's a weaker acid. Saliva also assists with speech and taste. So saliva has enzymes that breaks down food. Have you ever had that experiment in 6th, 7th grade? You put a little saltine cracker in your mouth. It's going to start breaking down without you even chewing or anything because the enzymes are literally breaking things down so you can absorb it into your body. So, the only thing that's kind of neat, or it's a kind of cool thing, so pineapple, you know how you get that weird tingly, that weird sensation on your tongue after you eat it? It's because pineapple has active enzymes as well. So while your body's breaking it down, the pineapple enzymes are also breaking down your body. So that's why you have that weird feeling in your mouth after you eat pineapple. Cool fact. Okay, so blah, blah, blah. Teeth. So, teeth, yep. Okay, so mastication, chewing, mastication, it's another word for it, like epistaxis, nosebleed, mastication, chewing. Okay, and then it talks about all the cool parts of your teeth and where they're at. So just know that teeth are embedded in and nourished by bone. Teeth are super important. So here's your gums, gingivitis, all that kind of stuff. Oral cavity is super important to keep clean and keep good. There's enamel. When you get rid of that enamel, then you're going to get that really sensitive part. I think it's the I think it's when you kind of reach the dentin or like you get rid of that protective layer. Anyways, though, teeth can become sensitive. Just know that. And if you don't take care of your teeth, you will lose your teeth. Okay. Then you have what's called the tongue. The tongue. So it's a tough skeletal muscle covered with smooth mucous membrane attached to 4 bones, blah, blah, blah. It is believed to be the only muscle in the body only attached at one end. Therefore, you can stick it out and you can use it to talk and you can use it to swallow, you can, whatever. Just remember though, when you are doing rebreathing masks, always check to see if that tongue is in the way. Stick a little oral tube in there and get it out of the way and you continue breathing. Okay, so then it also talks about what's called tongue tie. So the frenulum, if it's too tight, the tongue is not able to stick out as well, and they'll have like speech impediment and things like that. It's also been linked to sleep apnea. My aunt is a lactation consultant, and she was freaking out about the tongue tie for a really long time. She kind of is still. So if you've noticed, so just a tidbit, if you ever work in labor and delivery, or anything like that, if you have a baby that's having a very difficult time latching onto the mother, it can be associated with a really tight tongue tie. So check that tongue tie, get in there, and they get, like, you can look in and you can find it. People that know what they're doing should be the ones that really know what they're, like, doing that. Anyways, it's just a quick little slit and you're good. And the tongue has more movability, they can function more, so they're not working their jaw so much, they don't get tired, so they don't eat as much. So anyways, check the tongue tie. Yay. Okay, so just remember as well when it comes to things is that the ability to taste food also depends on the sense of smell. Smoking decreases both taste and smell. That's why when people quit smoking, they're like, wow, I gained like 100 pounds. It's because food tastes really good again and they just can't stop eating, like me. So, key concept. Oral mucosa on the underside of the tongue is very thin and contains many blood vessels, allowing absorption of substances placed under the tongue sublingual, such as when you have niacin, when they have chest pain, you put that little sublingual tab under their tongue. It's supposed to help dilate those blood vessels to help them relax again and their chest pain not to hurt. So that's why anything done sublingually is usually very fast acting. So like someone's having a heart attack, you give them aspirin, tell them to chew it, because they're going to chew it and all that little powder or whatever is going to get in their saliva and going to absorb in their tongue and go right in their bloodstream. Okay. So, jump in over to the pharynx. So it's a passageway, it's food for food and air, blah, blah, blah. Just know that because the larynx and pharynx are so close, a special structure, the epiglottitis, prevents aspiration of food and fluids into the lungs during swallowing. Remember, that's the trap door. Remember, if that thing gets swollen too much and that's a trap door, you're going to get killed by epiglottitis. Anyways, though, so pharynx. Key concept. The medical term for difficulty in swallowing is dysphagia. You will see that a lot, and you'll describe that in like stroke patients or any sort of neurological disorder, things like that. Then you have what's called the esophagus. So just the role of the esophagus in digestion is to serve only as a passageway. Oh my gosh, excuse me. Okay. So again, esophagus and digestion is to serve only as a passageway. No digestion takes place here. Food passes through in 5 to 10 seconds. So just know that it then connects to what's called the cardiac sphincter of the stomach, or the lower esophageal sphincter, LES is what it's short for, and then blah, blah, blah. So at this junction, there is an abrupt change from esophageal to gastric mucosa, known as the Z line. And on your bottom of your page on 303 on the right side, it has a little picture of the stomach and everything, and that Z line where it's connected. So just know, under this nursing alert, so if the LES does not close adequately, or the cardiac sphincter, the stomach contents can re-enter the esophagus, causing a severe burning sensation, heartburn, or acid reflux due to the acidic stomach contents. Untreated, this gastroesophageal reflux disease, or GERD, you'll see that a lot under your patient's diagnoses in the clinical setting. A lot of people have GERD. Can lead to esophageal or gastric stomach ulcers, and in more serious cases, bleeding, stricture, or precancerous conditions. GERD may be successfully treated with medications and lifestyle changes. So usually if they suffer from GERD, You have them sit upright for like 30 to 45 minutes after a meal to help just gravity take into effect, getting that food down. Also things that help with GERD, eating an apple. For whatever reason, that really helps. Pretty cool. Otherwise, though, losing weight will really help. And then just understanding maybe like what foods can cause more heartburn than others. Like my mom, cinnamon causes heartburn for her, so she doesn't eat cinnamon. So, yeah. Okay. Anyways, so that's pretty cool. Okay, then it talks about the stomach. I'm on page 304. So almost everyone's got a stomach. So, let's see here. Kind of cool about the stomach is that it's capable of being greatly distended and then very collapsible. So its abundant blood supply derives from the celiac artery. Stomach volume is approximately 1/5 a cup when empty, but it can expand to more than 8 cups after a meal. Haha, Thanksgiving. So that's kind of a neat thing to know. So they usually say like your stomach, like you eat the palm of your hand and then you can fill it. Yeah, I eat more than that. So special considerations. In infants, projectile vomiting with great force, like the full exorcism type vomiting, can be a sign of pyloric stenosis, narrowing of the pyloric sphincter, and can be life-threatening. So then it talks about all kinds of things, blah, 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 blah. So I'm at the bottom. The stomach's parietal cells also secrete intrinsic factor, enabling the body to absorb vitamin B12, which is important because it's part of the whole hemoglobin process and everything like that. So, key concept, stomach acid does not break down food particles. It provides the proper acid-base environment, allowing digestive enzymes to act on food. It prepares proteins for digestion and also kills unwanted microorganisms ingested with food. Okay, small intestine, blah, 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 blah. So, most digestive processes occur in the small intestine. Intestinal glands in the mucous membrane secrete enzymes, proteins that act as catalysts. To be absorbed by blood and lymph capillaries, carbohydrates must be broken down to simple sugars, monosaccharides, glucose, fructose, and galactose. Proteins must be converted to their simplest state, amino acids. Fats must be converted to fatty acids and glycerol. This is stuff you should know from nutrition, but if you don't, boom, you got it right here. So, key concept. Very few chemical reactions in the body can occur without catalysts. Each enzyme facilitates specific chemical reactions. Enzymes are super important in your body because it breaks down things for your body to stay alive. So, also, I know I'm going to read this whole little paragraph on page 305, but this is really good information. The small intestine also secretes other secretions. Mucus secreted by Brunner's glands lubricates and protects the intestinal lining from the highly acidic chyme and digestive enzymes. Cholecystokinin, a hormone, stimulates the pancreas to secrete pancreatic juice and the gallbladder to contract, resulting in the release of bile, which is secreted in the liver and acts to digest fats and lipids. Secretin, another hormone, influences the pancreas to secrete pancreatic juice containing bicarb ions to combine with sodium ions and form sodium bicarb, a basic alkali substance to neutralize the very acidic chyme. Boom. Okay, so know that small intestine has little cilia, little villi, blah, 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 pass food around, keeps things going. So, table 26.1, great table with all the digestive systems, their secretions, the enzymes, and their action. Awesome. Understand this, know this, really helpful when helping with your patients. Okay, then there's the duodenum, then there's the jejunum and the ileum. So just know that as the acidic chyme passes through the digestive tract, it becomes more basic, less acidic. This allows enzymes to function more effectively to break down nutrients into their simplest forms and facilitate absorption into the bloodstream. So now just know that this handout right here, this little guy. So absorption of the majority of nutrients takes place in the jejunum with following notable exceptions. Iron is absorbed in the duodenum. Vitamin B12 and bile salts are absorbed in the terminal ileum. Water and lipids are absorbed by passive diffusion throughout the small intestine. So, with anatomy, you're going to get way more into specifics with this. I'm just kind of glossing over so we understand the next chapter. Large intestine. Water reabsorption is the large intestine's main function. Intestinal bacteria inhibit growth of pathogens here. Some produce vitamin K, necessary for blood clotting. Absorption of vitamins and minerals and formation and defecation of feces also occurs here. Okay, then you have your cecum and appendix. Okay, so the appendix, known simply as the appendix with no known function. However, it has the same lymphoid tissue as tonsils, and as with tonsils, it frequently becomes infected. So they say, just take out the appendix, they don't need it. Like if they're having appendicitis, it's kind of growing for about, I don't know, a day to 3 days or so, and then boom, it like explodes and it has a whole other problem in the body. So if you ever have any problems with your appendix, let's see, it's in the lower right quadrant. So if someone's like, I have really bad pain right here, be like, ooh, it might be appendix. Let's get an extra CT. And you're going to see a really enlarged appendix, and they're going to be like, let's just take him to surgery and get it cut out. And they can usually go home like 2 days later. Okay, so remember that lymphoid tissue is that draining tissue, so it can help as a draining. Now, I think every organ is important, so I don't want any of mine removed unless I have to get them removed. Okay, then you got your colon. Great. Then you got your rectum and your anus. Great. So just know that, so the way the body works is it's going to go up the right quadrant, across, and then down the left side, and then into the colon and anus. So after a large meal, if you're ever tired, or if you want to help things go further or like go along, or if you're giving an enema, put people on their left side because it helps with the gravity and like the way your colon is in your body. So it'll help just digest better that way too. Okay, so key concept, it has the whole pathway of food through the body. Read it, know it, it's helpful. Yay. Okay, accessory organs, the liver and the spleen. The liver is so awesome. I love the liver. Okay, so the liver, the body's largest glandular organ, lies just below the diaphragm in the right upper quadrant. So it receives blood supply from the hepatic artery and is divided into 2 major and 2 minor lobes. Its functional unit is the lobule. So it weighs about 3 pounds. The liver plays such an important part in overall bodily function that severe disease or injury is life-threatening. Only the brain is capable of more functions than the liver. Only the brain. So cool. Despite everything your heart does, the liver is so important. Okay, so then there's a whole list of everything that it does. Super long. I want you to look at it. It's on page 307, the bottom right, to top of 308. Super awesome. I also heard something one time that you only need like 20% of your liver to like stay alive for it to function, and it can rejuvenate itself, like it can regrow back. How cool is that? And also, if you want to like do like a liver detox, you can do like dandelions will help, but be careful, it might like wipe you out and make you really tired, so just like lay low the day if you take dandelion tea. And beets, the red beet vegetable thing, super good for detoxifying the liver. It helps like totally clean it out. It's amazing. What else was really good for that? Sunflower lecithin. I don't know if you've ever heard of it, but that's also good for, so it helps make things thin. So I take it because my breastfeeding, like it helps prevent any clots like coming or whatever from like mastitis or whatever. It helps keep the milk thin, which also helps clean the liver. So that's super cool, but it makes it gassy. Ha! So just be careful. Also, crazy story. This guy received a liver from somebody, and I guess a year or 2 later, he married the person's widow, and then 7 years later, he committed suicide on the same day the other guy did. So it just goes to show that organs have memory. So it's important to like treat your organs right. Anyways, though, crazy story. Look it up. It's like, wow. Also, what was that movie? There's a really cool movie about a patient getting a heart transplant and they like fall in love. It's like super cute too. What is it? Anyways, I'll figure it out. Okay, so next is the spleen, is the body's largest lymphoid organ, lying near the liver. It produces antibodies and filters out damaged red blood cells. It's discussed in chapter 23, which we kind of talked about. So, nursing alert. Rupture of the liver can occur if a fractured rib penetrates the diaphragm. Since the liver is so vascular, this is an emergency situation. Usually anybody that has some sort of like organ tear, like or anything like that, they usually wear like a medical alert band like on their wrist until it's totally healed. And it's super important they wear something like that in case they're in another injury or any sort of accident or anything, because they can and will bleed to death if they're not careful. Okay, so then the gallbladder. Oh, 9 clicks alert. Just know the digestive system, tomorrow success. Yay. Then you have the gallbladder. It just like secretes stuff, yay, from the liver. Good to know. Then you got the pancreas. Has different enzymes. That's important to know. And then it helps with, let me see here. It helps with the regulating blood glucose levels and secreting insulin. So, table 26.2 on page 308. Really good. Also a similar table to like know, understand, and be familiar with. Then you have the peritoneum. So it is a large sheet of serous membrane covering and protecting many abdominal organs. It also secretes the thin peritoneal fluid, providing lubrication between its visceral, which is next to the organs, and parietal, next to the abdominal wall layers. So super important to have that. It kind of helps keeps things fluid and everything. It's like a nice big old sack. Okay, system physiology, process of digestion, you get absorption, enzymes. So enzymes often derive their names from the substances on which they act, and each enzyme is effective only on a specific nutrient. So go again, refer back to tables 26.1, and you'll see all the different kind of enzymes that go with the organ and then all the actions and functions. So mucus and water. The GI tract requires fluids to lubricate, liquefy, and digest food. Drink your water. Digestion in the stomach, cool stuff. So there's 2 types of cells in the digestion of the stomach. You have what's called the chief cells and the parietal cells. So where did that go? Okay, so the chief cells secrete different pepsinogen and gastric lipase. These enzymes need to break down proteins. And then you have what are called parietal cells. These secrete hydrochloric acid, which functions to activate pepsinogen and kill most stomach microorganisms. Another secretion of the parietal cell is the intrinsic factor, essential for life because it is required for vitamin B12 absorption, needed to develop red blood cells and bone marrow. Vitamin 12 deficiency results in pernicious anemia. Okay, so that's really important to know, those 2 cells in your stomach. Okay, digestion in the small intestine. So most digestion occurs in the small intestine. Here, cholecystokinin, a hormone, is secreted by the duodenum and jejunum in response to the presence of fat in the duodenum. CCK activates the gallbladder to release bile, which makes your poop dark. Ha! So then you have CCK also stimulates the pancreas to secrete pancreatic juice and do all of its functions. So good to know. And then you have some key concepts. Digestion is accomplished by blah, 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 blah. NCLEX alert. So just, again, knowing the digestive system, its functions, and how it works is really important. So then the absorption in the small intestine. Absorption of approximately, so this is I'm going to just read the whole paragraph because it's super important to know. Absorption of approximately 85% of nutrients used by the body occurs across the villi, small finger-like projections on the mucosa of the small intestine, into the capillary network. To increase surface area, villi contain microvilli, microscopic folds on the surface of epithelial cells in the cell membrane. So, blah, 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 blah. Villi wave to keep food molecules thoroughly mixed with digestive juices. Amino acids are absorbed in the duodenum and jejunum. Most fats are absorbed in the jejunum. Because villi are so important in absorption, they are heavily supplied with capillaries, which carry nutrients via hepatic portal circulation to the liver for further processing. Recall that active and passive transport in Chapter 17 are the means by which nutrients are absorbed into the circulation and then to the body cells. Absorption of nutrients into the bloodstream occurs via the small intestine. The body cannot use these food materials, however, until the bloodstream delivers them to the cells by transporting the particles across each cell's membrane. So not only does your small intestine have like the big villi, but it has like little microvilli in your small intestine. So think of like, you know, those like accordion thingies. So that's kind of like your small intestine, like in a wave form. And then imagine like a smaller, like little like sets inside each of those like folded parts. It's so cool how your body works. It's amazing. So just know that that's whole process is to keep things passing while like collecting as much as they can from any food that you're eating. So what you eat is what you are, 100%, because that's literally what your body is getting everything from. So, clean diet, clean life. Yay. Okay, so then it talks about fat absorption. Cool. And then it talks about absorption in the large intestine. Cool. And talks about metabolism. So you have what are called catabolism and anabolism. And I'm actually going to refer up to that key concept on the top of page 311. Perfect, boom, crisp, clear definitions. Catalysis is the breaking down foods into usable substances. Anabolism, using products of catalysis to build and repair body cells and maintain life. Awesome. That's literally the definition of metabolism. So it's the total of all physical and chemical changes occurring within the body to maintain life. Catalysis, anabolism equals metabolism. So people who have like a fast metabolism, their body is breaking down things way faster and needing like more nutrients and food and things like that. So usually like athletes, growing new individuals, puberty, blah, blah, blah. You know, that's what you're kind of going to get. And after a while, as your body is like aging, your metabolism tends to slow. So that really sucks when we get older. Okay, so then it talks about, so then the energy and synthesis and release, ATP, you should know that from A and P at this point in time, but that's literally like the energy building blocks for your body. And then you have elimination, which we all know about. Basically, we all poop. Haha. So if the defecation reflex is ignored, though, routinely, the impulse tends to die and constipation often occurs. This can be life-threatening if it results in bowel obstruction, which is very true. People are very uncomfortable. That may or may not be a Chapter 7 discussion, Week 7 in your lab. Take a look. Anyways, though, it's super important to always have a good elimination program. Everyone's different in how many times they poo a day or how many times they poo a week. Just know your patient's routine usually. And if they go, I haven't pooed in like a day and this is unusual for me, be like, okay, let's increase your water intake, you know, just increase everything that could help you get it going. Nutrition is a good thing to refer back to when it comes to knowing which foods to help them eat. Prunes are life-changing when it comes to constipation. Also, you're going to learn this, I think, in week 7 as well, is enemas. Super helpful in the elimination of waste and everything like that. People think, ew, gross, enemas, but really they are very helpful and they can be really good for you. Anyways, though, key concept, the stages of digestion are there, blah, blah, blah. And then I think that was it. So, and then just know this, though, table 26.4 on page 312. Again, we have an aging population. We're going to need to know these things to help them better in life and better in their outcomes. So the effects of aging on the digestive system: taste decreases, they're not drinking, they're not eating as much, things are getting slowed down, constipation increases, and they're just super uncomfortable. Then you have the increase in bowel medication, and then done that just kind of like, I don't know. So helping them stay hydrated, helping them eat good food is important, and helping them stay as active as possible. An active body, a body in motion stays in motion. That's what I truly believe, and that's what I've seen. Anyways, though, yay! Made that nice and quick. If there's any questions, please just email me. You know how to get a hold of me. And that's pretty much what I wanted you to know. So the other handout is the whole biliary excretion of waste products, elimination of bilirubin. This is, it's good to know. It's basically the same thing in your book. Just go look at it, read it. It's important to know. So anyways, though, have a wonderful day. Thanks.